Hello, everyone. Welcome back to episode 11 of Transform 360. I am your host, Sabar Shad, a pharmacist, mental health advocate, and your guide to personalized well being. This space is for all of us who are seeking more than just surface level health. It's where we have real conversations that inspire, educate, and empower us on our journeys. Today's episode is close to my heart, and we're talking about something that's reshaping how pharmacists see themselves and how the world sees us. In this episode, we will be talking to the founder and president of WritePharma, who is challenging the traditional pharmacist identity and creating space for creativity, authenticity, and impact in ways that we haven't always imagined. I'm honored to introduce my guest today. Dr. Alexandra Lastella is a doctor of pharmacy licensed in New York and California and is the founder and president of Write Pharma, the nation's leading pharmacist exclusive medical writing agency. A graduate of St. John's University Doctor of Pharmacy program, she completed advanced practice experiences in psychiatric care, infectious diseases, HIV/AIDS treatment, and non-sterile compounding, areas that continue to shape her clinical perspective. Alexandra founded Write Pharma to address the lack of pharmacist-driven voices in our healthcare media. Today, the agency delivers promotional, educational, and analytical content across the pharmaceutical, nutraceutical, and cosmeceutical industries and publishes two original platforms, the Write Pharma Drug Information blog and the peer-reviewed journal called Scriptum Pharmacologia. Finally, important to her mission is creating flexible paid opportunities for pharmacists nationwide. Through her project based work, she helps PharmDs expand their clinical and communication skills while finding balance beyond the traditional pharmacy setting. In the end, she leads with commitment, authenticity, respect, balance, and support for the literature, the data, and the people behind it. And through Right Pharma, she continues to redefine what's possible for pharmacists in evolving world of healthcare communication. I'm so happy to have you here, Ali.
Thank you so much. That was such a beautiful introduction. I couldn't have done it better myself, actually. Thank you so much for having me. I'm also honored to be here. I've never done anything like this. So this is a first. I'm very excited. And I'm ready to hear what you have to say to me, what you have to ask.
Perfect, absolutely. I have a lot of questions and then we have a rapid fire round. My first question would be when you founded Right Pharma to bring pharmacist led voices into our healthcare media, a space that we are often underrepresented. Did you ever feel at that time that you were boxed in by the traditional dispensing role and the assumptions around non-traditional pharmacy? And how did that experience shape your vision?
Absolutely. So I did absolutely feel boxed in. I actually worked for Rite Aid Pharmacy for almost nine, I believe it was 9 years before I left there and started Right Pharma full time. So I had a lot of experience in the community setting, both as a cashier, a technician, an intern, a pharmacist. I had really done every role there. And so I've seen through the eyes of every single level at the pharmacy and how everybody is treated, what the job looks like, the workload. And unfortunately, it is a really, it's a pretty brutal work environment. As you know, it's a very high workload. It's very stressful. I've got some statistics and things that we'll go over a little bit later. But absolutely, when I was at Rite Aid, it doesn't feel like you can really leave. Once you're there, there's never much opportunity to move forward, to move up. You can move maybe upwards in the company and become the district manager or something like that. But there's really no opportunity to jump into hospital or ambulatory care or research or some other field of pharmacy. So in those ways, yes, absolutely, I did feel boxed in. It's part of my nature, though, just to kind of break the mold and take leaps of faith. It's something that I've done my whole life. And also just like a side hustle, I'm a New Yorker. We do have a pretty strong work ethic. And even when I was in high school, I was doing like projects for other people just for like $20 here and there. So I always had something going on, whether it was related to pharmacy or not. And I started medical writing when I was in school, which broke me into that industry a little bit. I was writing for Eucora. They are a wonderful supplement company that I did some research for, and I've watched them grow over time. Now they're in big box stores, I believe Walgreens. So it's pretty amazing to have seen that. And I think that inspired me a little bit as well to get into business, even though I have no background in business, no formal training in business. But I've also moved across the country on not what I wouldn't say is a whim, but it depends who you ask. Um, so it was part of who I am to kind of do my own thing and step out of it. So, yes, I did feel boxed in, but I'm happy to report that I'm no longer boxed in, and I'm happy to be able to provide that opportunity to others as well.
That's awesome, and I know that takes a lot of grit and resilience. And I think they're mostly they're less wins and more failures. So thank
Absolutely.
you for doing what you do every day. I know it's a struggle.
Thank you.
And since you have a very strong clinical background that includes psychiatric care and disease and HIV, and those are the areas where nuance and empathy and accuracy really matter, how have those clinical experiences over the years shaped the way you approach medical writing and lead your team?
Absolutely. So I think what got me into medical writing or communications really in general is that these areas of care, so HIV, psychiatry, personalized medicine, compounding, things like this, where people really need to know about the medications they're taking. They need to understand their disease state, things like diabetes as well, where that patient education becomes vital to their prognosis. So, what I loved when I was working at Rite Aid was when I could take time to actually bring patients into the consultation room. It also gave me a nice break from the chaos of the day. But that's really where I felt like I could make a difference. And just going over some medications and seeing if there's anything we can eliminate, any duplicates, and just making people feel more comfortable, aware with what they're taking, and know what they're putting into their body and why it's important that they take things correctly is really important to all of those categories. And so that's kind of geared my writing style, where the topics that I like to go into. That's where I feel that we really need the education. And it's something that I always felt that I excelled at one on one, but now I like to take that and bring it to a bigger scale and share that with more people than just one at a time.
That's beautiful. And it's not just you're creating content, you're creating clarity, trust, and education, and that's clinical impact. Mostly when you're working in a traditional pharmacy setting and you have to move, there are a lot of barriers that one has to face. So, what was the biggest barrier in your opinion?
I'd say that the biggest barrier, in my opinion, would be financial barrier just to get started with everything. Taking that initial leap of faith. For me, it's not so much the fear of it, but the reality. A year later into it, seeing really the highs and the lows, like you had mentioned, of business. Some days are amazing and incredible, and then there are days where it's like, I don't know if I am cut out for this. But learn to just keep pushing. And even as pharmacists, we learn to do that too. We're trained when we're pharmacy students to just keep going. And we know that it gets hard and it becomes stressful, but there's no time to slow down at that point. That's when you really need to put the pedal to the metal and work a lot harder. And so that's kind of what I've taken from school and from pharmacy in general is just to keep going, even on those days where it's really difficult. And so I think that really just getting started and financially having enough to get started on the business and be comfortable taking that leap of faith. And that's just completely situational. For people that have a family and things like that, it's much more difficult. I understand that. But being single, younger, on my own, it really was the perfect opportunity. And I think that more people need to jump on opportunities as they're presented to them. You have to look for the opportunity. It will never land in your lap. You have to listen to your intuition and follow those.
That is beautiful. And for you, what was the then thing that just motivated you and you were like, I'm ready to, because most of the time we are not just ready to take the leap of faith, as you're saying. So what was the last thing and you were like, no, I have to just do it, no matter, maybe I don't have a clear path in front of me, but I'm still going to do it.
Absolutely. So I want to say that just throughout the years of being in community pharmacy, being in pharmacy school, I watched my friends, the people that became closest to me in that time period, really struggle after school. We worked so hard to get to where we were, get that doctorate degree. And then I see that they're suffering, working just at a regular pharmacy, brick and mortar. And it was unfortunate. And I hated to see that pattern. I started to see it in the managers that I had worked with. And as I became a pharmacist and got older and saw more so the people around me, not through the eyes of an intern or through the eyes of a technician, but as a peer, I really noticed the deterioration of just about everybody's mental well being. So the real tipping point, though, was I personally reached out to my district manager, my company, and I expressed my concerns with the way that things were headed. I had just started at this new pharmacy. I was a staff pharmacist there for about 6 months, and we had increased our prescription load immensely. I was not to toot my own horn, I was really excellent at Rite Aid. So we doubled our prescription count. We were so busy. I was trying to keep everybody happy. I unfortunately I had wonderful, wonderful staff. We just did not have the time to train them properly. Not enough manpower, not enough time. Whether I come in early or I leave late, it was just never enough. So when I reached out and I really begged for help for the first time in 9 years, and I was met with the answer of, don't work so hard, don't do the jobs of other people. And I tried that for 1 or 2 days. I couldn't do it. If I was going to do that job, I needed to do it to the best of my ability. And there was no way for me to feel safe at that time doing it like that. So I really drew the line. I said, my career, my degree is too important for this. I don't want to hurt anybody. And I don't feel that really the community pharmacy environment is safe for anyone. I think we all should be more cautious about our medications if we're picking it up from any big name store, really.
That's true. Totally, I totally understand. Lately there are like a lot of different news that come out based on how our working conditions are. I believe we as farmers don't advocate for ourselves, or we are just too busy people pleasing. Just yeah, it just gets hard.
Absolutely. And then I'll mention some of my statistics here that
Yeah,
I've
I would
pulled.
love.
So pharmacists, yeah, we have a lot of higher rates of suicide, depression, mental illness, and it's because of this workload and this demand that is never going to be met. You can only push people so far before somebody ends up getting hurt or hurting themselves, and that's really what we're seeing. So, right here from the Journal of the American Pharmacists Association, this is on their website now, actually. So the rate of suicide in pharmacists is 20 per 100,000. That is compared to, in the general public, 12 per 100,000. So it's a very significant increase. And what I found very interesting is that in all the other healthcare professions that were assessed in the study that the JAFA did, 61.5% of those suicides were committed by women in pharmacy. We were the only profession in which suicide was more common in women. Even overall, statistically in the nation, men end up completing suicide more often. But in pharmacists, it was the only profession in which women committed more suicides. And I don't know if that has anything to do with maybe the stress of also having a family and being there for your children on top of all of this. That I thank God I never had to deal with, because that's an additional stressor that I can't imagine having to do everything at the same time. And I also found it interesting that most of the pharmacists ended their lives with overdose with medications. And I mean, who better to know the medications and how much that we need? And it's very sad. It's very sad. So we need to address those issues. There's also an NIH study done in 2022, and I'll provide you all these links. So in 2022, they found that over 50% of pharmacists have burnout symptoms. No shock there. 40.62% reported moderate to high levels of emotional exhaustion, which is absolutely part of burnout, but a little bit different. I absolutely felt emotionally exhausted. And then pharmacy students, because this really goes all the way back to pharmacy school, I felt that I was primed to endure way more than should be necessary, than I should. And so we see that up to 52% of pharmacy students experience depression, of those that were studied, as well as up to 50% experiencing anxiety. And I would say that those numbers are probably much higher. The sample size, I'm sure, was not enormous here, but in reality, I think it's closer to maybe 3 out of 4 chronically experience symptoms like this, where it's not even their fault. We need to address it at its core and just really revamp the entire system. And I think it is up to us to get that done.
That's true. And thanks for sharing all those numbers. I had no idea. I never imagined the numbers were that high, and especially among women. That's an alarming number. And I think we don't just talk about it. So definitely need to not just the working conditions, but probably everyone's mental health.
Absolutely. And that's what I love about what I get to do as well. I found that I had this opportunity to get out of that environment to make my life better, really, even though maybe struggling a little more in certain areas now. And of course, I took a pay cut to get this done. But overall, I could never have wished for, I never imagined that this could be life and that we could do this as pharmacists. So I'm extremely proud of that. And I'd like to share that with other people. And so what we're doing now is as we expand our clientele base, as you know, we've been bringing in contractors to become writers for us. And the idea there is that these would be 100% remote, independent jobs, which pharmacists who are licensed in the United States, anywhere within the US, can work independently at home or on their own schedule, wherever you'd like, whenever you'd like, and to have that opportunity where it's also a viable income. And that's really important to me to provide that so that people actually can have families or can travel and can do the things that they love because we shouldn't be victims to the system.
That's true. And thanks for creating a platform for all the pharmacists out there.
Absolutely.
I had no idea there was something like this out there. So it's amazing. And you mentioned about the clientele. So what are your top clienteles, or who are you looking for?
Absolutely. So we've worked, I would say, equally with nutraceutical companies, compounding or outsourcing facilities. So with our nutraceutical companies, those are different vitamin brands. And what we do is update information for them that they hold on their websites regarding different supplements, conditions, and things like that, making sure that the safety data is accurate, up to date. Any studies that have come out recently that are pertinent to the condition or to the drug or to the supplement, we make sure to include those in their information, really communicate that information to the general public who's purchasing these. And then as far as the pharmaceutical industry or compounding pharmacies, personalized medicine, outsourcing facilities, these are all kind of in the same grouping. Those are personalized medicines. They're one of a kind. They are not regulated by the FDA. And who better to really communicate the importance, the potential, the safety, the information that we need to get? Who's better to communicate that than a pharmacist in this industry? So I think that really there is a gap there in communication. I think pharmacists can help to fill it and really just that certain subset that's interested or has a talent or a passion for writing that also wants to take that leap and have an opportunity to get out of, or not even get out, but take a step back from retail pharmacy and to see what they really would like to do and explore different options. Yes, that is the best part of the job.
That's amazing. Since you mentioned that Write Pharma is a flexible writing platform that offers opportunities to pharmacists who are, no matter what field they're in currently, it's not just about freelance work. Why building that platform was so personal for you?
It really goes back to my friends. My friends to me are my family. I love them just as if they were my siblings. And to see them suffer was just too much, really. And for myself, I could deal with myself, being in pain, and that's okay. But to see that happen to the people around me, for me, that was not okay. That was really where I drew the line. So that really is what keeps me going and every single day. And just to start to just at a micro scale to start to inspire people and what the feedback that I've gotten and just hearing that like you're trailblazing, you're really breaking this barrier. And I'd love to hear it. It keeps me going. Absolutely.
That's amazing. And I think that's where the real transformation is. It's not about giving people just another job, but giving them a renewed sense of purpose and possibility that they probably never imagined.
And a love for education. I love reading studies. I like dissecting them. I like knowing new information as it's coming out, what's on the horizon, what's coming next. And finally, we can use that education, or at least I feel that I can use that education and those skills in drug literature that I did learn and apply them and actually create clinical change, or try to at least. And I think we're getting there.
That's true. That's true. And you've been doing tremendous work behind the scenes. So thanks for that again. And
Thank you.
since we have launched two different platforms. One of them is a blog, and the other is a peer-reviewed journal. And I believe the blog, where you have the drug information system, that is freely accessible by the public. And these aren't just channels; these are basically pharmacist-led source of knowledge base. And in a world where unfortunately we have so much misinformation and so much noise, what role do you see these platforms are playing in restoring credibility and maybe help amplify pharmacists?
Absolutely. So everything we do at Right Pharma is completely pharmacist exclusive. And the reason for that is, like I've been mentioning, the people around me that I saw suffering at our level, I felt that I could help this group. We can't do everything, but this one group, I could do something. Yes, we do have those two platforms. Everything we do is pharmacist exclusive, and we accept open submissions from pharmacists nationwide. So as long as you are licensed within the United States or attending a pharmacy school, as long as they're an ACPE accredited university or program, I should
Mhm.
say, then you are able to submit research and be published on either of those platforms. The drug information blog is more casual and it serves to inform the public. That's why it's open access, completely free to the public to read up on, and absolutely go to the website if anybody wants to see that. It's www.writepharma.com, WRITEPHARMA.com. And so our drug information blog is public facing, but our peer reviewed journal is a bit more formal for healthcare providers, for researchers, and that really focuses on investigational medicine and
Mhm.
personalized therapies as well. So we're looking at drugs that might already be on the market, how we can repurpose those drugs as we get this new research about different doses, reacting with receptors in different ways, and things of that nature. We find that different drugs have different uses, and we're just discovering that. Whether or not those things are profitable for the pharma industry is not what's important to me and to our cause. What's important to us is the results that we're seeing. Doesn't matter if the company is going to make money on that. I want the people to receive the information that's going to improve their health. And I think that's really where we need to fill that gap. So as pharmacists, we are not, although we're paid well, and thank God for that, and we work very hard for it, but we're not as respected as we should be as well.
Yeah, that's true. I totally agree to that, which is kind of sad at times as well.
Yeah, absolutely. I invite any pharmacists that are listening to check out either of those platforms and look into submitting any research, old or new, that you've completed. If you have something left over from pharmacy school that you thought was really incredible that you never published, it's a good idea to go ahead and submit that, and we can look into it. We'll have it reviewed by our other team members and our pharmacists. It'll be peer reviewed, looked over, and we'll go ahead and we'll publish it as long as, of course, it meets all of our requirements. But more information on our website if anybody is interested.
Perfect. That's amazing, and thanks for sharing that. Anyone who is interested, please reach out to Ali. She's really sweet, and she would help you to the best of her ability.
Absolutely.
Um, Based on whatever you have shared with us, what would you tell the next generation of PharmDs who are afraid to color outside the lines?
I would say that the lines are changing as we speak. I think the future of pharmacy is shifting. We're seeing it now with Rite Aid just shutting all of their doors, with so many CVS's, Walgreens closing down. Although the demand is so high inside of the store, it's just incredible. And so I would say that a lot of people are starting to make this transition, and especially when you're young and you have the clinical education, you have the experience behind you, you just got out of school. They're the smartest, right? We all know that pharmacy students, right before they take their NAPLEX, is the smartest you're ever going to be. So that's the time, really, when you need to start thinking about taking these leaps of faith. And like I started in pharmacy school as well, and so I think that really that was significant for me. And I think getting it started as soon as you can, but it's also never too late. And any pharmacist can get started. There are no pre-requirements other than that pharmacy degree, other than the enrollment in that university. And so that's what's special about this program.
That's perfect, and thanks for sharing everything you did. Now as we're closing in, I would like to close with a quick rapid fire round and just say the first thing that comes to your mind. What is one morning ritual that you would never skip?
Coffee,
Okay.
absolutely.
Right. Most underrated skill a pharmacist brings to healthcare.
Communication.
Amazing. Favorite drug name to say out loud, just because it's fun.
Hmm. Benserin.
Okay. Okay. What's your personal mantra in just one sense?
Go for it.
I love that. When you're writing, do you prefer coffee, tea, or energy drink? Or
All
what
of
do
it. I need three drinks: one for hydration, one for
you?
caffeine, and one for pleasure.
Okay. What's the dream vacation destination for you right now?
Bora Bora.
Okay, that's amazing. And what's something that's totally unrelated to pharmacy and you're surprisingly awesome at?
True crime. Information about serial killers. Strangely enough.
Okay. That's a good one. I didn't know. That's amazing. I feel like we got a good perspective on clinical lens, but a little peek into the fun side of Dr. Alexandra. Thank you for playing along and for everything that you have shared today. Yeah, it proves that transformation isn't always about leaving your profession. It's about gaming it, reframing it, and rewriting it with a purpose. And if you enjoyed this episode today, don't forget to subscribe, rate, and share Transform.
Absolutely.
Yeah, and remember, transformation starts when you stop asking permission for others from others. Thank you so much, Dr. Alexandra. It was
So fun. Thank you.
thank
Good
you
luck.
so much. Yeah, thank you.